Good afternoon, everyone. Thank you for joining us for our weekly discussion on COVID-19. For many of us, this week has offered a time for peaceful protests and demonstrations and to reflect on how our actions and values as individuals, and certainly as our Arlington community, are affecting change. So focus today on COVID-19 in our community, in particular phase 2, which begins today in Arlington in Northern Virginia. And I'm so glad to have with us today not only my colleague Matt DeFerranti of the County Board, but several members of our county's leadership team. We're joined by Deputy County Manager Jim Schwartz, Dr. Erin Miller, the Director of Emergency Management for the county, and our Director of Public Health, Dr. Ruben Varghese. We are continuing to trend in a positive direction. We are seeing fewer hospitalizations due to COVID-19 and fewer positive tests. So the governor has announced that Northern Virginia will move to phase 2 starting today. We are reminded, though, that the virus is still very much with us, and we must continue to be vigilant and responsible in how we move about our community. We must continue to be aware of practicing social distancing and, most importantly, wearing face coverings. So before we get to your questions, I'm going to turn it to Matt for a few highlights from this week.
Thanks, Katie. We continue to support several initiatives that are intended to support both our businesses and help our residents. To date, almost 200 businesses, multifamily properties, and religious organizations have signed on to our We Are Covered program, which provides them with badges to show customers and visitors that they are committed to upholding Virginia's requirement for face coverings in public buildings. We received over 60 applications for temporary outdoor seating areas, called TOSAs as our acronym, to help residents and restaurants reopen and expand restaurants' outdoor space. We've received approximately 240 reports in our new online reporting tool, which you can get to from our main COVID-19 webpage on the left-hand side. This tool helps us track where there might be compliance issues in our community so we can focus on our education efforts so everyone can wear masks and help us slow and stop this disease. This week we had the opportunity to have conversations with the Ethiopian Community Development Council and APS immigrant families on a range of COVID-related items, including testing, food, financial assistance, and more. Next week, we will distribute face coverings to over 70 community-based organizations, including churches, synagogues, nonprofits, and PTAs to distribute across their networks. And finally, and very importantly, we will host a second free COVID-19 testing event next Friday, June 19th at Barcroft Fitness and Recreation Center. This testing event is free of charge and does not require individuals to be symptomatic or to have a previous appointment or doctor's note. No identification is required. Before we get to questions, I do want to just pause and remind everyone that as part of our social safety net, we need to make sure that all residents in Arlington will take the 2020 census. The census is absolutely critical for ensuring fair congressional representation and brings approximately $50 million in federal funding each year to Arlington for important health, transportation, housing, and emergency services in our community. If you have not taken the 2020 census, please take just 10 minutes to do it online at my2020census.gov. So with that, send it over to you, Katie, for the COVID questions. As a reminder, you can submit comments in the Facebook chat, or you can also text your questions to 571-348-3053. And we'll do our best to get to as many questions as possible. Katie?
Great. Thanks so much, Matt. So let's start a little bit with the metrics. Dr. Varghese, you've been tracking, along with the other public health directors of Northern Virginia, the assessment of a number of metrics to determine what kind of progress we're making in our efforts against COVID-19 in our community. Could you share a little more about where we stand in terms of those metrics now?
Sure. Thank you, Ms. Bristol. Very pleased to note that our metrics have improved from what the governor had originally proposed on April 24th. We've seen a decrease in the number of tests that are positive, which as we see the number of tests itself rise. We have seen a decrease in hospitalizations due to COVID. And that actually is the thing that makes me most happy, is that it's a way of having a pandemic curve that we're seeing with hospitalizations. the fewer hospitalizations we have, the better that is for all of us. And so those are the metrics that actually I think are good for us to follow. And I know people are concerned about the protests. We're monitoring to see if there are any spikes related to that.
That's great. And actually, I did want to ask about that. We've definitely heard from members of our community who are concerned about how those restrictions associated with physical distancing and wearing of face coverings are going with regard to the pretty large crowds gathering during recent demonstrations here in our community. Could you say more about what we're seeing and what we will be tracking associated with gatherings and displays of support for racial justice?
Sure. So we are going to continue our contact tracing, and as we mentioned last week, we want people to exercise their constitutional rights, and we're asking them to do it in the safest manner possible. So encourage that people have been wearing face coverings to those sorts of protests, and that they're keeping to small groups and keeping distances away from other groups. And we're asking proactively, if we get cases, what the sources are. We can't, of course, change it, but it's our reminder to tell people if we're noticing things related to protests, reminding people, and this is a great platform, if everyone can remind people, please protest safely. For example, wear a face covering and use signs rather than yelling and screaming, because vocalization can spread germs. And as you indicated earlier, we still have the virus in our community. We still have community transmission. Even though the numbers are going down, and it's probably less, it's still community-wide. And so we are all doing our part. Protest safely, wear your face covering, and use signs rather than your voice.
Great. Thank you, Dr. Verghese. I'm starting to see a few questions come in on Facebook. Thank you all so much for doing that. We are going to get to them. And again, the text line is present on the Facebook chat as well if you'd like to send in questions by text. Let me ask, again, either Dr. Verghese or Aaron Miller to talk a little bit about phase 2, just some highlights about what that should mean for our residents and businesses before we go to listener and viewer questions.
Sure. So I'll start out. So many people may have heard that the governor announced that Northern Virginia, as well as a few other locations, were moving forward into phase 2, as was mentioned. What we want to encourage folks is that because we're moving to a different phase, does not negate the fact that we still need those core 4, right? We still need people to wash their hands, stay 6 feet apart, wear face coverings, and continue to monitor your signs and symptoms and take care of yourself. Staying home is still safer. You'll notice that it still says there, stay safer at home. Some restrictions are generally easing, and those vary by sector and those vary by activity. So you'll see, for instance, that there are some additional restrictions relaxed on certain places of business, on restaurants and things like that. And in particular for certain aspects of outdoor recreation and gathering in public places. I'll advise everybody, the virginia.gov/Virginia website has a lot of specific information about each sector and what it means for moving into phase 2. And so those sort of mandatory practices across farmers markets, across brick and mortar retail, across your fitness and exercise facilities, religious services, for example, all of those things differ greatly in order to ensure that we are following the best public health guidance that is out there.
Excellent. Thank you so much. Matt, do you want to highlight the first question that we're getting?
Sure. So we got a question about playgrounds, and I wanted to see if Jim Schwartz, maybe this one would go to you. It's a question about whether, given that we're opening restaurants, what's involved in that decision, and I know that you've been thinking some about it. Thanks.
So thanks. The playgrounds, we are still working on the specifics of when we open playgrounds and how we open playgrounds. Right now, we are targeting June 26th, 2 weeks from today, as a date to open those. But playgrounds present us with some additional difficulties because we're not in a position to clean the equipment. I would note that very similar to playgrounds, Fitness centers are allowed to open at a 30% capacity here in phase 2, and the restriction is that the equipment that people are using must then be cleaned after each use. So if you think about that in terms of the playground, even though playgrounds are outside, we have the same kind of difficulties with equipment that we're not in a position to clean after every user. So we're trying to think through how we open playgrounds safely. When we do, we will still be mandating social distancing and the use of face coverings for anybody over the age of two. But it's something we're still working on the details of, but look for us to get those details out here shortly, and a likely opening for playgrounds on June 26th. Dr. Varghese, I don't know if you want to add anything to that.
Thank you, Jim. One of the things that I want to remind people, and you're going to keep hearing it, and it's what Dr. Miller was talking about as well, there's going to be a significant element of personal responsibility that we have to have parents especially think about at playgrounds. So, and this is just directly from CDC, and I want to make sure people hear it, because playgrounds can often become crowded and social distancing is difficult, we've already talked about cleaning those surfaces is not going to be something that we're going to be able to do. So if you choose to visit a playground, do it sensibly, maintain a distance of at least 6 feet away from people you don't live with, because as I said, the virus is still here. Wash hands with soap and water for at least 20 seconds, especially before going and when you get home. If you can, bring hand sanitizer with you so that you can supervise your children when you're using that. You don't want children to use hand sanitizer, especially young children, without supervision, because it's 60% alcohol, which actually can be toxic and deadly for kids. Wear a cloth face covering at these sites as much as possible for anyone older than the age of 2. So you can enjoy it. I think we have to make sure the playgrounds are used appropriately and give the county time to get it up and running in a safe way possible.
Great, thank you, Ruben. And that roots us in the science. And I also think, Jim, your point about we don't have the capacity to clean those playgrounds at this point. So we're continuing to work on this. I can only imagine, I know, Katie, with your little one, you are ready for daycare and ready for playgrounds. I can't walk in the shoes of a parent who's had to live the last 4 or 5 months with a 2 or 4-year-old. But hopefully that gives you a sense for the questioner of why we're a little wary in that case and why we're not there yet. Whereas indoor spaces in restaurants and even some local other jurisdictions may not have the precise same rule that we have. So over to you, Katie.
Yeah, that's a great point. And I think we can definitely trust some of our older kids to not touch their faces, wash their hands appropriately, sanitize equipment. I can tell you my 15-month-old would certainly not be up to that. Yeah. Great question about public transit. When we can expect to see WMATA buses, ART buses, Metro Rail starting to add service. I just want to touch on this because it's such an important one. It's one we've been thinking about, although I don't have a date certain yet. We are starting in some of our agencies to see incremental increases in ridership, but we are still at dramatic lows, in some cases 5 or 10% of what normally might be. And so there is going to be something of a dance of service increasing as folks are ready to come back. And as long as we can do it in ways that protect, in particular, drivers and train operators. We've been really concerned about that throughout. Certainly the WMATA drivers have been concerned about that. You've seen the implementation of some strategies, for example, like suspension of fare collection so that people can board through all doors, and other efforts to try to reduce exposure, especially for the people driving those vehicles who might have the most exposure otherwise. So no date certain, but we do look forward to communicating as that service ramps back up. Again, you can find out more information on our county website about the service that we do continue to offer, certainly not nearly as frequent in the ways of headways, et cetera. But the service that does remain for those who we know rely on or prefer to use transit to get around. And I think we can share a link of where to find more about that.
Great. So I think that link will be posted online shortly. And did you, as far as questions, I'll just go right to masks because we did have a couple of questions about masks. And one is concerned, both are concerned about whether how we can enforce this. And really our best tool there is the arlingtonva.us COVID-19 website, where there's a tool on the left side to report if you're seeing at a location where there are significant challenges. I do want to say that this is, something that we're having to, all of our residents, we want to wear masks. And so enforcing through the police is just unlikely to be our way for success. And so that's a point on masks. And then multifamily buildings, there's a question about masks in the common areas of multifamily buildings. And that's one where it really helps. I know in my building, whenever I walk outside my door, I have a mask on. But that's hard to enforce for everyone. So the best tool is to report it, to let us know, so that either public health or someone can stop by this multifamily building and see if they'll remind people, and also apply for our Work Covered program. So that's a fair bit on masks. I don't know if Ruben or Jim, you want to add anything on masks?
Yeah, I'll defer to Ruben, but I will just say, and let me connect this back to something that Ms. Crystal was talking about a few minutes ago. We are requiring masks when people ride our county art buses. And if people show up and need transit and don't have one, we have secured a cache of them that are allocated to each of our buses, so that when people get on, if they don't have one will be made available to them. So just trying to help out those that may not be able to source them, may not be able to locate them for transit. And then Ruben, I'll let you talk about the multifamily dwellings and some of the enforcement pieces.
Sure, thank you. I'm going to remind, and it's going to be like a broken record, we have the requirement, in a sense, from the governor's order. We also have the personal responsibility to protect each other. And so that's the thing that I'm going to remind viewers, that in the multifamily dwellings, those common spaces are just like going to the grocery store. So we're encouraging you to wear those, and reminding that you're protecting your community, you're protecting your neighbors, and by their wearing it, they're protecting you. So that is what, from a public health perspective, is really required for our community to be resilient and to stop this virus from spreading. So I will leave it at that, and I support what Mr. DeForante said. Report when it's necessary, and if we see patterns, we will do the reminders that are appropriate. But also remind your neighbors why this is important.
Right, polite requests can go a long way. So, Katie.
Yeah. Well, I appreciated, Jim, your comment about providing masks to those who need them, whether it's on art, transportation, or anywhere else. That's been really important. And I know we have a good comment coming in Facebook that they are looking to government to help people get those masks and to continue to spread the message about its importance, and not just rely on individuals making the right decisions. So we hear that. We are working on it as well to distribute the masks to those who are not wearing them. Here's a question about the science, actually. Maybe one for you, Dr. Verghese, about antibody testing. What do we know about it? Is it getting better? Is it getting more reliable? Is it getting more accessible? And what's the best way to get it?
Okay, great question. Antibody testing is starting to become probably more available. What I want to remind people of what the purpose of antibody testing is: did you have a prior exposure? That is technically the only thing the antibody testing will tell you. Is, were you exposed, if it's specific to the coronavirus or the COVID-19 virus, did you or did you not have exposure? I think there are people who are hoping that that exposure information will then tell you, okay, then I'm immune from this and I no longer have to wear face coverings, I don't need vaccine. None of that is actually information we will know now, because it's only with time we're going to know whether or not antibody test, if you're positive, actually shows that you actually have lifelong immunity. So as CDC recommends, and I will recommend as well, even if you if you have a reliable test through your healthcare provider that shows that you were test positive for prior exposure to COVID, you still have to do the face coverings, keeping the distances, because we have no evidence that it's protected and that you can't get it again. So for those who want to know, they can work with their healthcare provider to see what they would recommend. And I have to tell everyone, please, please continue to protect yourself and others by keeping the distances and using face coverings.
Great, thank you. Thank you, Ruben. We have a question that's come in on a subject a lot of people have asked about, yard waste and pickup of yard waste. So Jim, did you want to handle that one?
Sure. So unfortunately, yard waste and our refuse collection more generally has, like so many other aspects of our lives, been affected by COVID. Specifically, many of the contractors that we rely on to do our collection, their workforces have been affected by COVID. You know, think about it, those are some of those frontline workers that we don't often think about, people that are out doing their work very much the same way they were doing it pre-COVID. And some of them have been exposed and have come down with the virus and therefore are unavailable to their companies to be able to provide services. So our Department of Environmental Services has had to curtail some collection and unfortunately yard waste, as well as some of the large item collection that people in the community are used to, has had to have been set aside so that we can continue to do the normal refuse collection and recycling. And I would note that the amount of waste that we're all generating out of our homes has increased because we are spending more time in our homes. Much of the commercial waste has probably declined. You know, the Bosman building, as an example, doesn't have as many people in it, so it's not generating as much waste. But the human beings generating that waste still exist. It's just coming from a different source or in a different location. We right now are projecting that we will not be able to resume yard waste collection until at least the end of July. Obviously, we're hoping for better circumstances than that, but just to give everybody an idea of where we're forecasting, we're probably another 6 weeks away from being able to resume that service.
Sure, thanks, Jim. And there's also the drop-off sites, the 2 or 3 drop-off sites which you can access, I think, through our COVID-19 website.
Correct. That's true. People can still take it themselves and get rid of it.
Great. Katie.
Excellent. Well, I'm going to try to take this one, but would love to invite maybe Jim in particular, if you've got any insights further to shed about the temporary outdoor seating areas. These were one of the big steps forward with phase 1 to allow and enable restaurants to be able to serve up to 50% of capacity in an outdoor way, to do that safely. We have a great question from Jillian, noticing that some of those TOSA's, temporary outdoor seating areas, seem to be using the parking lanes on the street for their outdoor seating, so that pedestrians have to walk through the sidewalk, through the business of the restaurant, as opposed to using the sidewalk for the restaurant and then creating a pedestrian bypass. I know we can't get into case by case. I don't know what specific restaurants are of concern, but is there somewhere folks can reach out to ask questions about why the configuration is the way it is, and suggest an alternative one?
Yeah, I think, and Matt mentioned earlier, the website that people can send in. The question was in the context of face coverings and some of the other things that we're trying to help manage. People can go to that website also to report those kinds of things, and we will be able to go take a look at it, evaluate the situation. We're really hopeful that as we get into phase 2 now and restaurants are able to start opening up some of their interior areas, again, at 50% of their capacity and maintaining the 6-foot distances and the use of facial coverings, especially by servers. We're hoping that some of those initial wrinkles in our outdoor seating will be smoothed out a little bit. But people can certainly let us know of circumstances. We'll investigate it and try and work with management to try and correct any problems.
Great. Thank you so much.
We're getting a couple of questions about libraries, which is part of the shift in phase 2, and I believe it's June 15th where there will be curbside opening. But I think maybe it's again to you, Jim, I think, on that one.
Right. So next Monday, June 15th, our central library will open for pickups. So people that have gone online and made an order for books and are told that that order is ready will be able to go into the facility. They will obviously be asked not to come pick up books if they have been sick in the last 14 days, meaning a fever, a cough, or if they have been exposed to anybody that has been diagnosed as having COVID virus. And they will be able, with face covering, to go into Central Library and pick up pre-ordered books. The rest of our libraries, the rest of our branch libraries will not yet open. We will continue to evaluate the situation, as we move further into phase 3. And it's probably a good time to note that the county manager right now has a number of task groups that are looking at how we are going to reopen towards, I guess what is now being called the new normal. How will we do business in the future? But we're taking that slow. But Central Library next Monday, June 15th, Libraries Director Diane Kresh and her staff have done a tremendous job in getting ready for this, but it'll be an iterative or incremental process over the next couple of weeks and months.
Great. I really think that sort of process is important for folks to know. We're just at phase 2 and we've got more to do, and what we see as far as the data is going to be really important as we go forward. Over to you.
Great. We're getting questions about 2 entities at maybe either end of the age spectrum. I'm going to see if I can combine 2 pretty disparate questions into one. The first is about long-term care centers, which is, I know, something that our public health team has been working committedly on, reducing outbreaks, addressing good and better practices there to help protect both residents of long-term care facilities and workers. So I'm going to ask Ruben to talk about that, and then we're going to come back to child care centers, which similarly is a good question on the minds of many in our community.
So long-term care facilities are obviously a concern for the county, and I want to remind viewers, if they're not sure why, that those who are older or who have chronic medical conditions or both are often housed and live in these facilities, and so they're at risk for COVID complications if they get exposed to it. And given that these facilities are restricted to visitors at this point, it's only staff. It's staff coming into the facilities that can initially introduce the virus, and then of course it can spread from residents to staff to residents. And this is not something unique to Arlington. This has been happening across the nation, and unfortunately even in Arlington. So what we've been doing, building on what we normally have done all the time with these facilities, we partner first of all with our Aging and Disability Services Division in DHS, and we provided infection control recommendations. As this has evolved, we've actually now been sending people in to observe the infection control practices, to help instruct facilities to do a better job with their staff on how to wear the personal protective equipment in the right ways to prevent the transmission and so on. So this is a commitment that we've made to help improve the conditions, but it's a tough thing to do because you've got a confluence with another problem. You've got workers who are essential workers who are often underpaid and may work across facilities, and since they're essential, they can't stay at home. So they're at more risk for being exposed in the community. So we've got 2 issues that are combining, and what we're trying to do is make sure that the facilities also provide them with the resources to protect the workers themselves and to protect the clients. And public health staff are in the facilities reviewing their procedures to try to improve infection control outcomes. So we have information on our website, which we can post on the chat so that people can see what we're doing in long-term care facilities.
Thanks, Dr. Verghese. So child care centers, definitely another thing on the mind of parents as they begin to reopen. I think a parent put it really well. Is it safe to send my kid back to daycare? So wanted to share just a couple of efforts at the county level, in particular our Office of Child Care Licensing, which maintains pretty detailed relationships, deep relationships with a lot of our child care centers and operators across the county. I know that they have been in touch on a pretty regular basis with providers about some of those practices, including sharing guidance issued from the Virginia Virginia Department of Social Services. Child care centers have been able to stay open throughout the pandemic, and more now, in fact, are opening as we move into phase 2. Some of the practices that our staff have been working with them on are rearranging the rooms, limiting the group size, creating individual play stations or activities. One that I know we've heard from a lot of parents and daycare providers that they are starting to consider encouraging parents to drop their child at the door with a staff member and not walking inside the building. So we can share in the chat our FAQ for parents about childcare centers in the county, the guidance that we've been giving them, and hopefully some answers to common questions that parents may have. Ruben, I don't know, we keep putting you on the spot, but if there is anything else you might add, I know that your team, Public Health, is certainly working with our Child and Family Services Bureau as well.
Sure. The only thing I would add to your already excellent advice is we want to make sure that parents make sure that they keep their children home if they're ill. I know there's sometimes that balancing act. It's a horrible thing to have to be thinking about having to work and find daycare for your child. But if they're ill, the best thing is to keep them at home. And if you can stay with them, be the one providing that care and not let them get better and not have anyone else get ill at the center, whether it's other children or the staff.
So important. As a daycare family myself, I know sometimes you might push it if your kid's been sick for a number of days, maybe send them back as they start to turn the corner. We really need everyone in our community to take the strong steps that Dr. Verghese was sharing to really be safe and to err on the side of not spreading germs, and particularly the risk of COVID-19 at this time.
Great. So 2 questions regarding facilities, a couple of questions regarding pools, both community pools and indoor pools, the APS pools. And I think maybe that's a question that there are some phase 2 guidance with respect to it, but on APS pools and also on community pools, the questions are good ones, and it's central to many folks' lives, but it's also an implementation challenge, and we're just opening. I don't know, Jim, if you want to touch on pools at all.
Sure. So as you said, Mr. DiFranti, the in phase 2, pools are allowed to open up. Actually, pools were allowed under phase 1 if they were limited to lap swimming and 1 person per lane. In phase 2, the pools, both indoor and outdoor, are allowed to be open, again, for lap swimming, diving, exercise, and swimming instruction only. And then they are limited to no more than 3 persons per lane with a distance of, and this is a different social distancing metric, it's 10 feet within pools. And the same goes for diving, limited to 3 persons in the area and a 10-foot physical distancing. Here in Arlington, I can't speak about community pools. I don't know where they stand right now, but I'm sure many of them are anxious to get open given the new guidance and the time of year we find ourselves in. And we just had a discussion the other day. I think APS, who manages the indoor pools here in the county, is planning right now on how they're going to open up under these new circumstances, but I don't have any details as yet. As soon as we know something, we'll post it and let everybody know.
Great. We have to, what's allowed under phase 1 and then now phase 2, we have to make sure we're safe in the process, and we're working through those questions. Go ahead, Katie.
Great, thanks. We had a question come in over the chat line about the reopening of Clarendon House in particular, which for those watching along, Clarendon House is a community-based rehabilitation program for adults with serious mental illness. And I think that actually is not only a great question in its own right, and one that I might turn to Dr. Verghese to help with, but also a great opportunity to talk about mental health services in general in the community at this really challenging time, what's available and how people can access them. So Dr. Verghese, I'd love to start with you on both the Clarendon House question in specific, but maybe mental health services in general.
Sure. While I can't speak to the specifics on Clarendon House, the approach for us at DHS on reopening is the balance between what are the needs for the clients and can the service be provided still safely or at best with distances versus is it important to bring people back and how to do so in a safe fashion. So these things are being discussed at the department level, and I'll leave it at that. We realize in general mental health services are important, and the department has continued with those sorts of services using telehealth as the primary method, and they have seen some clients also physically at the Sequoia complex as it's appropriate. And then there's the larger issue of the mental health for our whole community. COVID is a challenge for anyone, and the stay-at-home order and how to wear masks and so on and coverings is something that we do need people to take very seriously and grant a lot of grace to each other, because we've been spending a lot of time together in ways we have never done before. And how do we actually give people passes, because everyone's trying their best in this circumstance. But also, that's why we've said, go out and exercise, go for a walk, do it safely. Take a break even from your home setting if you can, for that few minutes to be outside so that you have some alone time. If you're attached to a device, turn the device off, unplug, because the world has a lot of information and we need our brains to sometimes just rest. So those are my immediate reactions to that, Ms. Crystal.
Thank you so much. And we will also share a link to our mental wellness resources related to COVID-19 in the chat as well.
Okay, we have a question about this weekend as we enter phase 2 and Arlington County Police. And I think it's probably worth talking about the Arlington Restaurant Initiative and what we've been building on. The question is whether police will be out in restaurants. And I think, Jim, you're probably best on this question.
So thanks for the reference to the Arlington Restaurant Initiative. This is an initiative that the Arlington County Police Department started a few years ago. It has, quite frankly, become a national model. It was initially developed with a focus on how restaurants could partner with law enforcement, really in educating the people that were coming to their facilities, coming to their establishments, to be more responsible in their drinking, their use of alcohol, a way for us to better educate the public and incorporate the actions of bartenders and others in the establishment to ensure that things didn't get out of hand. What came about as the result of that is really a strong relationship between the restaurant community in Arlington and our police department, and a high degree of trust and, I think, mutual reliance. So I say that by way of introduction into the idea that our police are actually not in a position to enforce the governor's orders. The governor, when he laid out the different phases and the different restrictions that we all find ourselves adhering to now, he put the responsibilities for enforcement with public health. And as everybody probably recognizes, public health is pretty busy right now. So this takes us back to the issue that Ruben has harped on a couple of times, both on this chat and in previous town halls, and that is asking people to act responsibly, asking people to follow the guidance that we have been able to provide. If they witness bad behaviors, if they witness non-compliance, certainly let us know, and through either the restaurant initiative or other means that we might have, we'll try and work with establishment owners and managers. But I can assure you that we're just not in a position to have our police walking the streets and essentially policing compliance with these requirements. It's not the kind of police department that we have, it's not the kind of community we have, and it's not the kind of way that the governor has empowered us with regard to enforcement with all of these provisions.
Great. I really appreciate you providing that context for the restaurant initiative. So if folks are seeing challenges like this, it's, a polite request to your server or the owner of the establishment that says, hey, can you just watch that? Or it's, not saying to the whole group, but saying, hey, can you guys be careful? And then also letting us know if there's a challenge so that we can not be sort of minute moment-to-moment policing of every second that you're doing something, but instead trying to help us all stay safe. This is a big moment going from phase 1 to phase 2, and we're all going to have to take responsibility personally and for each other.
So another question at the intersection of public safety and COVID-19 is about, we have one coming in over the text line about the work at the Arlington County Justice Center to prevent an outbreak among our incarcerated residents and the work that the sheriff is doing there. I know that Ruben, or Dr. Verghese, you've been working pretty closely with Sheriff Beth Arthur, who's been taking pretty extraordinary steps to try to keep that population of residents safe, as well as working with the courts in their work as well. So could you maybe speak to some of those efforts and being cognizant of the privacy of individuals, share anything you can about what we're seeing in those facilities?
Sure. I think our sheriff has done, and the jail has done a phenomenal job in their planning for COVID, and have, during this entire crisis, they've worked with the court system to, first of all, not have as many people, first of all, be in the jails if there's no reason for them, if the Commonwealth believes that it's not necessary for them to be in the jails. So they've emptied as much as they can. And so they've actually had more space available that, should anything be needed to isolate folks so that disease doesn't spread, they've taken the right precautions, and they've provided the right masking and emphasized those things for the staff, because like any other thing, it's now the staff that are going to be the risk for bringing the germs in. And so they've done a very good job of reinforcing that. And so they keep working on that and keep emphasizing that. So from that perspective, I've been very pleased with the efforts that they've made to protect those in jail, because they do know that the only source of infection at that time is going to be from the outside. And because of the space, if they have had to bring in new inmates, they have been able to isolate them and watch them for 14 days, separating them from the general population before introducing them. So that way it prevents a spread. So for those things, I think it's been well handled, and they know how to call us if there's disease either identified by for the staff or those in jail.
Thank you.
We have a couple of questions about community centers and office space guidance. If you look at the governor's phase 2, it's still, if you can telework, that's encouraged. As far as whether we will put out or there will be put out guidance on office space, I think there are some resources available online, but that's also a challenging one that we're working on with county staff. And then also there's community centers. Both are questions that I know we have been looking at, Jim.
We have indeed, and as I mentioned earlier in the town hall, the manager has a number of work groups that are focused on specific areas to figure out, how we're calling it the comeback, how we come back, because we, like everybody else in the community, has to manage this safely and effectively, as you mentioned, Mr. DeFerranti. What I would tell you is that we don't have a date yet on community centers. That we're still working on, how we would open those back up and how we would manage, again, all these notions of all these requirements for social distancing and such. I will tell you that as we are thinking about opening up our own office facilities, one, I would say to the questioner, the Centers for Disease Control has resources available, as does the governor in his phase 2 guidance. So we won't be issuing any specific guidance to the community, to private office dwellers. But to use us as an example, we are looking at not occupying our office facilities at any more. Again, we have not nailed this down yet, but I would say we're not going to occupy them at any more than 30 to 40% at a time. And that is in order for us to manage social distancing. We will not be having people in cubicles next to each other. We're going to try staff rotations where that is possible. We're looking at reconfiguring our spaces. As an example, we have an employee It's referred to as a lounge. It's really like a lunch area on the 9th floor of the Bosman building. We are looking at reconfiguring that as a space that can allow us to spread out a little bit more and use those spaces to get our work done. But again, while managing social distancing, there will be a requirement that employees will wear face coverings. And that we will continue to mandate that people not come to work if they have been sick in the last 14 days or been exposed to somebody that has been diagnosed as having COVID. And then again, we're doing things with messaging throughout our buildings, and obviously through our other channels, email and such, about those core four that Aaron mentioned earlier in the town hall. Foremost among them, washing your hands with great frequency. So while we're not going to give specific guidance to private office dwellers, we might be able to provide some examples and the kinds of things that we're looking at. And there are other resources out there like the CDC guidance.
Mm-hmm. Thank you.
All right. A number of questions too coming in about schools, particularly county coordination with schools as schools make decisions about reopening and how. And a good question to tack onto that too about how the virus is transmitted between kids or from kids to adults. So specifically, the question is, do kids give the virus to each other? And do they give it to adults? Is it different from kids and adults? So at the important administrative coordination level, could we talk a little bit about the partnership with public schools and county, both in terms of public health, emergency management, and other related elements? And then any insights, perhaps we can tap Dr. Aaron Miller in his public health knowledge as well for that question about how the virus is moving between kids and adults.
Sure. So I'll take a little bit about that. Yeah, one of the things that we want to emphasize is the virus, like every sort of other pathogen, continues to evolve, and we continue to learn more about it on a daily basis. You'll notice that even across the scientific studies which come out on a weekly basis now through either the CDC's morbidity and mortality weekly reports or journals like the Lancet or the New England Journal of Medicine, that as patient populations continue to grow and as more people are exposed, it's only then that we truly really begin to understand how the virus impacts us and how it impacts people in different age groups and those with different underlying health conditions. We know as a fact that individuals that have chronic health conditions or those that are immunocompromised are at a greater risk. We know that those, for instance, that are elderly are more susceptible to some of the effects and in particular, maybe some of the comorbidities that only heighten the effects of the COVID-19. Really, you saw just this last week a great degree of consternation over whether asymptomatic and symptomatic transmission was a thing. And I will say this, we are going to continue to learn for the next 12, for the next 18, for the next 24 months as to what the impacts really are. The thing that I can say in general remains true is that this virus, much like its other analogs and much like things we've seen before, whether it's SARS, MERS, or a cold or flu or whatever it may be, our best and absolute sort of highest priority is, I go back to it, and I sound like a broken record, like Jim Schwartz just said, the core four. Wear that cloth face covering, keep your 6-foot social distances, wash your hands, and monitor your symptoms. We know that the symptomology is different amongst many people. And we know, for instance, that sometimes the incubation period can range up to 2 weeks. And so it could just be that slight tickle in your throat, right? That slight mild symptom. And we see that with many people, that they don't experience any sort of greater symptoms than that. But as you all have iterated, and as we continue to iterate, it's not just about you, right? It's also about protecting the rest of the community. And it's also about assuring that those that are vulnerable within our community, whether they be immunocompromised, whether they be folks in a multi-generational household that have, for instance, older parents or family members living with them, that we keep them safe and healthy as well.
Thank you. And would you be in a position, or is this maybe a question for Jim, about coordination with public schools from the county side, making sure that we're bringing all of our resources in emergency management and public health to bear on their decision making?
Sure. So I'll speak on my side for a little bit, because I have a wonderful counterpart within the Arlington Public School System. They have an Office of Emergency Management. They have an individual dedicated to sort of the preparedness and planning functions, as well as organizing, coordinating the response like we do for the county at large. Great partner that we have there in ensuring that we're in sync, not only with things like personal protective equipment, right? So making sure that what we send up to the state and federal agencies to have supported, that we're counting what the Arlington Public Schools needs in order to continue to deliver some certain programming. As far as sort of reopening, coordination, as well as setting strategy, I'll defer to Jim about, and I will mention that the new superintendent I know has met not only with the manager, but some of my staff have met him and his team, and I cannot speak highly enough about the skill and experience that he and the APS team has brought to bear on this incident.
Yeah, so I think just to add to that, we're still in the early stages of what schooling is going to look like. When the governor announced phase 2, one of the highlights of his announcement was bringing forth the Department of Education, who seemingly from the very beginning of this crisis, when the governor shut schools and said that they would be closed for the rest of the year, the Department of Education, the Commonwealth Department of Education, has been working on a plan. I've not actually seen it, but I understand it's quite extensive in providing guidance to local school systems. And the upshot of that is that each local school district is going to have to develop its own plan and demonstrate to the Department of Education how they will bring learning back online in the fall. The secretary cautioned that it's probably going to look like a combination of in-person and distance learning. There's a host of ways that the school systems will probably be going about this, but I'm encouraged that at the Commonwealth level, they've been really taking this seriously and have been looking at what kind of guidance and what kind of resources they can provide to the local school systems as they figure out how to use their resources in the best way possible to open schools back up, next year. So I would just say at this point, more to come on that.
Okay. Thank you. All right, Matt, do you want to pose the final question before we go to wrap up?
Sure. Maybe I can. There's one question, and maybe I can just offer two thoughts in addition, and then we can close. So the question is about testing, and just looping back, it's about whether there'll be testing for those who may have gone to protests and want to be sure that they can get tested. And the big thing is next Friday at Barcroft, another full day of testing. Free. You don't need an identification, but that's the big next step. So, Jim, did you want to add on that?
The only thing I would add, absolutely without an order or without symptoms, that site next Friday is the best option. But if people participated in the protests, and especially if they discover that somebody that they were in close proximity to during the protests has now tested positive for the virus, then they should consult their healthcare provider to see if they can get an order, in which case they can use either the Virginia Hospital Center testing site on Quincy Street, on North Quincy Street across from W&L High School, or the Inova site that is on Lee Highway to get a test. I would say that we, on this issue of testing, we are continuing to look for resources. We are very hopeful that we'll have another kind of capability in the near term, in the near future rather, to do testing. We're looking at some capabilities for people to do what's referred to as self-collection, where they will be able to do their own, sort of a collection in these kinds of mechanisms. It's a test of saliva that people would put in a tube and then give back to us. Then we would connect them with a laboratory to get the results. So there's a lot I think that you're going to see expansion of testing capabilities coming up. But right now, I would just urge people, if they have a primary healthcare provider, see if they can get an order. If they don't, we continue to maintain the site at Arlington Mill, where people can go through the free clinic to get access to testing.
Great, thank you, Jim. That's really helpful detail, and I hope it reassures the person who asked the question. We'll just close. We are a couple of initiatives we're covered. We really want to emphasize that. That's a way that businesses and buildings can make sure that masks are a part of what you do. Aaron mentioned the core 4 a couple of times: wash your hands, social distancing, mask, and those is essential. And then this is a big next step that we're all going to have to be really responsible in. So over to you to close up.
Absolutely. One other thing to add about the testing, we know that talking to a doctor to get an order is a barrier for some of our community members most affected by COVID-19 to date, particularly our low-income residents, our uninsured residents, our residents who may be undocumented or mixed status families. And that has been a top priority for us at county government. We are working with our safety net providers, including those like Arlington Thrive, which helps us with emergency financial assistance, our affordable housing provider, our homelessness services center, our domestic violence counseling center, and many others, to ensure that low-income people or people who are at risk have access to testing without a doctor's note. So if you think that may be you, the best, and you're not already connected to one of those community-based providers, the best number to call is our Economic Assistance Bureau, and we can share that note in the website. For whether it's worth, that's also the number to call if you're having a hard time paying rent, utilities, need food, or any other support. We are very focused on trying to help you get what you need to get through this difficult time and stay healthy. So for everyone, we encourage you to visit arlingtonva.us/COVID-19. For any additional questions that you may have, you can also call our hotline, 703-228-7999. And exactly as Matt said, as we enter phase 2, it's going to take everyone in our community doing their part. We are trying to do our part by increasing testing to Arlington and the region. So again, that date is Friday, June 19th, starting at 8 a.m. at the Barcroft Community Center for free testing with no doctor's order required. Thank you for joining us. Please be safe and well. Take care of yourself, take care of each other, and we look forward to seeing you next week. Thanks so much.